It's the early 1920s, and a great sense of shared purpose drives CSL to broaden its portfolio of medicines. Hard work is tempered by lunchtime dances, tennis games, and the odd fox hunt. While research is not a mandated priority, staff constantly innovate to improve quality, yield, and speed of production. Soon, there are CSL vaccines for typhoid, diphtheria, pertussis, and tetanus. But it's an exciting new scientific breakthrough from a team at the University of Toronto that showcases CSL's growing international reputation for quality production.
This man is one of our people. He's not a butcher or a chef, but he spends all of his time instructing abattoir staff on how to remove the pancreas glands from cattle and pigs after slaughter. These glands are the sole source of the insulin, which is used to control diabetes.
Prior to the availability of insulin, diabetes was a death sentence. People didn't suffer from diabetes, they died of diabetes.
Incorrect dosage or poor purity could have a devastating impact on patients and compromise the reputation of the product. So the production rights holders take no risks in assigning licenses. They choose just 4 organizations around the world. CSL is one of them. Making the latest medical breakthroughs available to the Australian people becomes a trademark of the organization. And insulin production remains a cornerstone of CSL's expertise for the next 60 years.
And the demand for the product is growing as more and more diabetes is being diagnosed, and diabetics are living longer because of insulin.
In the early 1900s, agriculture is the backbone of the Australian economy, so protecting animal health becomes a significant focus for CSL. Black disease has been wreaking havoc in the nation's sheep flocks before a vaccine is invented by the Australian government's premier research organisation, the CSIRO. CSL translates the scientific breakthrough into practical outcomes, manufacturing large quantities and reducing the disease to negligible levels. It's 1928, and returning from his summer holiday, Alexander Fleming discovers mold has grown on a petri dish. Subsequent experiments prove the power of the substance to fight bacterial infections. But in order to treat infection in humans, he must discover how to isolate the active ingredient and produce sufficient quantities. Eventually, with one of the greatest discoveries in history at his fingertips, but without the financing or production expertise to continue, Fleming abandons penicillin. Through the 1930s, an economic depression hastens a return to war, in turn stimulating scientific endeavour that might offer the combatants an advantage. The dormant treasure of penicillin piques the interest of the Australian Howard Florey and his German collaborator Ernst Chain. Together, they set about resolving the issues that had thwarted Fleming. They managed to isolate the active ingredient in their lab and then apply the production expertise of beer manufacturers to help grow sufficient quantities. With the code cracked, the wonder drug is made available to Allied forces in time for the D-Day landings. On the other side of the world, a former CSL employee named Val Baisley is on active duty in the jungles of Papua New Guinea. He is deployed to America to learn the penicillin production process before returning to CSL. Seen here, Baisley's handwritten notes provide the foundation for CSL's remarkable production success, enabling Australia to become the first nation to make penicillin available to its civilian population.
Within 6 weeks of arriving back in Australia, Baisley had produced the first dose of penicillin, which was shipped up to Papua New Guinea and saved the life of an Australian soldier dying of sepsis. Within 10 weeks, he'd produced several 100,000 doses, which could also be used in civilians.
He worked like a dog, and the people around him worked like dogs, because every one of them understood that what they were doing was of national importance.
It's a truly extraordinary Herculean effort. The situation for vaccine manufacturers changed dramatically after the Second World War, because with the development of penicillin, it became possible to maintain living cells in culture and therefore to isolate a whole range of viruses. And there was a tremendous wave of new vaccine development during that period of time.
One disease that continues to elude science, despite enormous investment, is polio myelitis. Highly visible and life-threatening in severe cases, the dreaded polio can leave bodies crippled and the community paralysed by fear.
Social events were either cancelled or curtailed. All the schools were closed.
There was no effective treatment at it. If you were paralysed, you remained paralysed.
My parents, like the whole of the rest of the community, were so terrified that I was sent off to live on an isolated farm with absolutely no contact with anybody other than the owner of the farm.
When I was at Fairfield, we had a whole ward full of people in iron lungs who'd acquired their infection in the 1950s and spent the rest of their lives with artificial respiration.
Fresh from the success of penicillin, CSL's Val Baisley travels to America, where he takes up a position as lab manager for a little-known scientist named Jonas Salk. By growing the polio virus in animal tissues, the team unlock an extraordinary breakthrough and are soon able to deliver a vaccine to a desperate world.
The world went crazy. There was nothing short of hysteria. It was comparable to the impact that it would have today if someone announced a cure for cancer.
There was a sense of joy, and people like Baisley became national heroes because the fear had been so great.
With the vaccine in hand, the response of CSL and the Australian government is swift, decisive, and brilliantly effective.
This boy is like thousands of others throughout Australia who have been made safe from polio, and it doesn't hurt a bit. The millions of doses are the first step in the immunization campaign now well underway, which means that another disease is coming under control.
25 million doses are administered to the public, and by the late 60s, the disease within Australia is effectively consigned to the annals of history and the memories of those who lived through it. Making international breakthroughs rapidly available to the Australian people put CSL at the heart of the great public health campaigns of the 20th century. But the times are changing, and the relationships between governments, corporations, and the people are being transformed by free market forces. Within a decade of their heroic polio blitz, CSL's vaccine is rendered obsolete by superior technologies, and both insulin and penicillin are on the same trajectory.
The multinational companies were able to manufacture on a scale that we couldn't even dream of. And the penicillin that came from those plants was sold in Australia for less than CSL could buy an empty bottle.
With the loss of these products, the organisation faces a crisis of identity. But in another area within the Parkville complex, the seeds of the organisation's future are already beginning to sprout.